When we begin the question and answer session, I'll first ask any of the panelists if they have clarifying comments or questions, and then we will open it up to the general public in the meeting. I won't make lengthy introductions of the panelists because their CVs or bios are all on the website, so there's no reason to repeat that. First, I'd like to begin by making a few general comments about the region and this panel. The session looks at aspects of COVID-19 in the border region, both of the Imperial Valley and also of northern Sonora, in the area that fronts on the reservation of the Tohono O'odham, which occupies about 65 miles of the Sonoran-Arizona border. This border region that we're looking at today is a very complex part of the region. Imperial Valley has a relatively small population of about 130 or 180,000, which has declined slightly since 2018. This contrasts with a very large population across the border in the municipality of Mexicali, which is slightly over 1 million people currently. Both sides of the border share very high poverty rates. Poverty is defined by each country, not a universal standard across both sides of the border, but approximately a quarter of the population or more of each side of the border is defined as poverty level. Another characteristic of the region is very unequitable distribution of income on both sides of the border. And this is a tendency that has increased over the past several decades. Despite the claims when NAFTA was negotiated and begun in the early 1990s about bringing prosperity to the border, the prosperity has not really been shared by most of the working population. That really, I think, sets the background to a lot of what we'll be talking today, because we're talking about people who are economically challenged and have difficulties with housing and basic services. Another characteristic of the region is the great economic asymmetry across the border, a picture that has also worsened in recent years as well, as the U.S. has grown economically faster than Mexico. The economic asymmetries drive a significant flow of people back and forth across the border. And I think most important for what we're talking about today is the flow of migrants from Central America and Mexico northward, and their attempts to cross into the United States. And at the same time, we have a daily or periodic flow, very large flow of people who live in Mexicali and adjoining regions of San Luis, Colorado, who commute across the border to work in the Imperial Valley and in the Yuma Valley in the agricultural industry. This is a very large flow of people, perhaps 20 to 30,000 people during peak season, and it forms a very basic part of the life and economy of the region. In addition to the migrant farm workers, there's a large resident farm worker population in Imperial County. However, the resident population have significant problems in terms of finding adequate housing. There is a housing crisis in the Imperial Valley, which partly the result of increased pressure on housing by the a fairly large influx of very well-paid federal workers. And this has helped create housing shortages that's trickled down to many different levels. Many of the permanent residents of the Imperial Valley are undocumented, and so they face special difficulties in terms of accessing services, and constantly are concerned about encountering immigration authorities. Nonetheless, it tends to be a fairly large number of people, and many of whom have lived in the region for many years. These undocumented people don't have the ability to live across the border in lower cost Mexicali, where they could have better housing and other conditions. The COVID-19 pandemic hit this area hard in February and March of 2020. And the federal response, the government response of both nations was really lacking, really a failed response. It was very reactive. It showed very little forethought. An immediate reaction of US authorities was to close down the border to some degree. And even on the Mexican authorities at the gubernatorial level, closing the border and preventing workers from working with part of the mix. All of these things were done without really sound science-based evidence. In April of 2020, as the pandemic worsened, agricultural workers were defined by the US as essential workers, which is very important in terms of facilitating cross-border movement of agricultural workers. And also it provided a level of security for many of the undocumented workers in the Imperial Valley, with letters attesting to the fact that they're essential workers. And in terms of permanent residents, essential workers, we'll see two cases today, one from the Central Valley of California and another from the Imperial Valley. Now, a related paper, a presentation that we'll have today, looks at the issue of migration and COVID in the border region, but it looks at the Sonora, Arizona border region at the municipality of Altar, directly south of the Tohono O'odham Reservation. And it looks at how criminal organizations have preyed upon migratory groups from southern Mexico and Central America. And this movement, which has been going on for some years and has worsened and increased in recent years, really reflects long-term problems in Central America, plus ongoing demand for labor in the US. And the pandemic presents a significant complication for this migration movement. And another complicating factor is with the construction and reconstruction of border barriers and infrastructure and increased enforcement, it's made passage to the US more difficult, more dangerous, and forced more reliance on criminal elements for getting across the border. So today we look forward to very interesting presentations. First, I'd like to mention that we have time limits of 10 minutes or so, and I'll give you a heads up when your time is just about up, and also Alexandra will help with that. So without further ado, let's go into the first session, which will be by presented by Daniela Flores from the Imperial Valley Equity and Justice Coalition, and Luis Flores from the Imperial Valley Equity and Justice Coalition. Daniela has an MPH from Berkeley, and Luis is a doctoral candidate at the University of Michigan. They have co-presenters who are listed on your program, but are co-producers of the study, but I don't think they'll be presenting today, so I won't present them formally. So take it away. I guess, Daniela, you're going to start, or is Luis?
That's right. Luis will join during the Q&A portion if there's anything at the end that he might want to add, so I can take it away.
You might want to say a word about your other co-presenters and the larger project so we understand that.
Absolutely. Thank you so much, Dr. Genster. All right. Well, good morning, everyone. Buenos días a todos. Thank you for joining this panel. My name is Daniela Flores, a community health advocate and organizer with Imperial Valley Equity and Justice Coalition. As folks have mentioned, I'm also joined by my brother and co-organizer, Luis Flores, also from IV Equity and Justice Coalition. And we're joined by our SDSU partners, Mercy Villaseñor, Dr. Annie Keeney, and Dr. Amy Quant. So, and they're here as well. During the Q&A, they may also contribute depending on the questions that come through. Together with funding and partnership with the UC Davis Western Center for Agricultural Health and Safety, we conducted a study to assess the stress of daily migrant farm workers and those that lived in the Imperial Valley during the COVID-19 pandemic. As folks mentioned, you know, they were deemed essential workers per government guidance. As many people here know, in California, Latinos were disproportionately affected by COVID-19 infections and deaths. In the state, suffering affected Imperial County particularly, as the county had the state's highest death rate from COVID-19 infections. Part of this disparate impact has to do with the overrepresentation of Latinos and Latinas in essential work, like farm work. Statewide, Latinos accounted for 95% and immigrants accounted for 85% of COVID-19 deaths among farm workers in the state. So it's well established that Latinx immigrants live with health inequities, and the impact of COVID-19 was unfortunately no exception for Latinx farm workers. Today, I'm humbled by the opportunity to share on behalf of our team on this binational platform with so many scholars, community leaders, residents, advocates, activists on this beautiful border region that has shaped so many of our experiences. I'll share key learnings from a farm worker stress survey we conducted this year, and we'll share with you our recommendations for addressing farm worker mental health and workplace conditions that impact farm workers' mental health and physical health. Imperial Valley Equity and Justice Coalition brought community members together to advocate for equity during the pandemic at the local, state, and federal level. Equity in COVID-19 testing, equity in PPE access, and more recently, equity in COVID-19 vaccines. We partnered with other community members, organizations, and healthcare providers under the initiative Salud Sin Fronteras, or Health Without Borders. As a response to barriers to vaccine access among farm workers, older adults, and Spanish-speaking households, IV Equity and Justice formed a Spanish language farm worker hotline using Google Voice, completely volunteer run, and conducted in-person registration pop-up in Calexico farm worker transit points, allowing us to register thousands of farm workers with our Salud Sin Frontera partners. Today, we celebrate having the 7th highest vaccine rate in the state. We're humbled and grateful for the efforts of the Salud Sin Fronteras volunteers and the efforts of other community-based organizations and their contributions to adapt outreach to make sure that those hardest to reach were not left behind. On the left side of the slide, we show our volunteers at one of the vaccine clinics. We pre-registered farm workers for this clinic. It took place at 3 in the morning, blocks from the border, as farm workers waited before the workday. I share all of this because the farm worker stress study that we're presenting upon today, it builds upon the efforts of that I just mentioned that took place during the pandemic. And we reached back to 200 farm workers that called into the vaccine hotline to invite them to participate in the farm worker stress survey. So many of these surveys actually ended up happening in person at pop-up events. And you can see an image on the right side of the slide where our volunteers in the orange vest are administering that survey. Our goal was to document the experiences of both farm workers that live in the US and those that cross daily as daily migrant workers. So through the survey, we found farm workers, we asked farm workers about their experience with 39 stressors. Right here on the screen, we display the top 12. So you'll see the top 6 stressors in red and the top 7 to 12 in orange. We also asked demographic and basic health information. We found that 40%, nearly half of farm workers that responded to the survey reported elevated stress that can be associated with depression. This is significantly high and alarming number, considering the impact that elevated stress has on our physical and social well-being. As a border community, we have seen farm workers lined up to cross the border through the night while others sleep. Sure enough, farm workers feeling like they don't get enough sleep was the top stressor reported in our survey. Followed by difficulty being away from family members. Migrant and farm workers living in Imperial Valley have an extra several hours of commute time, up to 6 hours, especially those traveling to Yuma and Coachella valleys on top of their long workday. Many hours go unpaid for this commute, yet they contribute significantly to the stressors that they experience because they're away from their loved ones and among all the other reasons. And as you can see, many of these stressors being interrelated. Farm workers also attributed poor weather conditions to their high levels of stress. Everyone here has experienced the unbearable hot days, and they have to work in the fields even when it's raining. And unfortunately, with the hotter summers and hotter climate in general, these have been often lethal rather. Other top stressors include not having medical care, long work hours, and difficulty communicating in English. Farm workers feeling that bathroom conditions are bad is also a top contributor. So you see it here in orange. At the beginning of the pandemic, the city of Calexico closed public bathrooms in the downtown area, and they remain closed today. Migrant farm workers that cross in the middle of the night don't have any access to bathrooms while they wait hours to get picked up and begin the workday. We also heard that bathroom conditions are bad at the work site when bathrooms have gone too long without cleaning. And unfortunately, this was not uncommon. One surprising finding was related to substance and alcohol use as a stressor. We found that stress from being around substance use at the workplace was high and clustered with other stressors related to workplace environment. We came into this study thinking that we would find differences in stress levels between migrant workers that cross daily compared to those that are living in Imperial Valley. But we actually found similar elevated levels of stress among both groups of workers. Instead, we found that farm workers with the highest stress scores were more likely to be born in Mexico, regardless of where they live now, and they also tended to be older. We did ask about COVID-19 infection, and we found that similar rates between both groups, possibly suggesting workplace and household transmission rather than in the transit to the farm sites, to and from farm sites. In a previous slide, we showed the lack of sufficient sleep, long work hours, and stress related to being away from family members. We found that farm workers living in Mexico had an average one-way commute of 3.3 hours and up to 6 hours one way. So, and Imperial Valley residents had about a 1 hour commute on average. Farm worker mental health has to be a priority as our country and our county reflect on the devastating inequities that we see during COVID-19, and as we dive deeper to address the root inequities that we see in our community. Our survey and engagement with farm workers provides supporting evidence of the inadequacies of workplace conditions for many farm workers. As our cities and counties receive millions of dollars in agricultural communities, decision makers must prioritize farm workers that are essential to all of our livelihoods in the United States. Specifically, the American Rescue Plan, or ARPA, is to be used, quote, to address the public health and economic challenges that contribute to the unequal impact of the pandemic. Currently, no allotment of ARPA funds in the county or Calexico plans is specifically directed at addressing the impact of the pandemic on farm workers. Both county and cities have interpreted ARPA's goal of funding the essential workforce very narrowly, as pertaining only to county and city employees, and not, for example, grocery workers or farm workers that were also classified as essential workers. We need to treat stressors like substance use and bathroom as workplace conditions. For example, we urge funding to go to fixing up and opening up the public bathrooms in Calexico so that farm workers can have a dignified place to take care of their needs. We need to allocate funding to invest in substance use resources for essential workers and invest in stress reduction, support for community healing, and invest in mental health education and resources that are responsive to the needs of the experiences of our essential workers. We need to recognize through our policies and programs the stress related to healthcare access and language barriers. We are long overdue for a significant investment for targeted health campaigns to help essential workers navigate the healthcare system, health insurance, and a focus on preventative care, chronic condition management for both physical and mental health. And finally, farm workers who were among some of the hardest hit by the inequities during the pandemic will be experiencing collective trauma and likely are already experiencing this trauma after living through this and seeing so many loved ones impacted. We hope to see efforts focused on community healing as we progress forward. Without any targeted resources and investment, this will be harder to achieve. We hope that today's presentation helps raise awareness of the mental health stressors that farm workers live with, and that these findings lead to actions and advocacy that address the root causes of the inequities that we see in our communities that are impacted and in our farm worker community. We're grateful for the opportunity to share this space with you all and truly welcome any of your questions and comments during the Q&A portion. I want to take an opportunity to thank our partners at San Diego State, our partners from Salud Sin Fronteras, our Salud Sin Fronteras volunteers, funders at the UC Davis Western Center for Agricultural Health and Safety, Latino Community Foundation, and to the organizers of this conference. And finally, to all of the farm workers that do such crucial work in our communities. Muchas gracias.
Oh, thank you very much. Terrific presentation and excellent study. And I look forward to some discussion about some of your recommendations during the Q&A section, because you've clearly identified a series of issues. And the great question is, well, what do we do about them and how? But thanks again. So we'll now move on to our next presentation, which will look at binational collaboration toward a better and brighter border region by Gil Rebollar, who's the Public Information Officer for the County of Imperial. Um, Gil, are you there ready?
Yes, and I'll be joined by Esperanza Colio, who is our Deputy CEO. I believe she's on, but before we start, she'll start off, but thank you for this opportunity, and we agree, and we're in agreement with what you said, Dr. Ganis, as well as what Daniela said on our disadvantaged communities and the inequities that our border region faces, and we are grateful for local organizations like the Equity and Justice Committee, and as well as Salud Sin Fronteras, for their work in addressing possibly some of the gaps. As we said, we are limited on resources, not just simply funding, but also in the workforce and local government. I know you said highly paid federal workforce. We're local government, and we are limited on some of the things we can do. And so anytime these community organizations come together to address a community in need, we are grateful as we can learn from them and just capitalize on their actions taking place. And like I said, we are a very unique region. We county population, 1/10 of our neighboring cities. So it's a unique region with unique issues and unique resolutions. But let me attempt to share my screen, and Esperanza will take it away. It'll be a little shift, probably in tone in our presentation, and we'll look for the conversation that will happen from it. Esperanza?
Hello. Hi.
Hey, go ahead, Esperanza. You're.
Yes, I am here. Good morning, everyone. My name is Esperanza Colio. I'm the Imperial County's Deputy CEO. And my job during the COVID-19 was to serve as the Office of Emergency Services liaison with the city of Mexicali. They made that determination based on my dual citizenship. I was actually a student. I graduated from University of Baja California in accounting, and then I moved to the United States and work in the county as well. So I work on both counties, the municipality of Mexicali, before I moved to the United States. So I have a sort of understanding of how the government works on both sides of the border. And so with that, let me begin by saying that the County of Imperial recognizes that the city of Mexicali and the County of Imperial is a region, one region. We're not separated but by a fence. But in a sense, we share family connections, and we share also jobs opportunities in which our population crosses the border every day. Before the pandemic, we performed a study that shows that around 52,000 people were crossing the border on a daily basis. They were crossing the borders for different reasons, for shopping, to work, and for many other reasons. And so with that in mind, the county also recognized that when the border was closed, was limited to workers or residents in Imperial Valley, we find out that 20-something thousand people were still crossing the border. And part of the population that was continue the border, the crossing of the border, we recognized that the farm workers community, which is a vital element in our County of Imperial for our economy, we had to take some steps forward to prevent them from getting COVID-19, but also to disseminate the virus. So just to give you an idea, Imperial Valley's number one economic contributor is the agriculture, with 2.9 billion in production and processing. So that just tells you how important the farm worker community is for us. And for that reason, we take the following steps as a proactive steps to protect our communities and our farm worker communities. As mentioned by the previous presenter, there are different situations that happen at the border on a daily basis. Specifically, the crossing of the border occurs between 2-3 o'clock in the morning, all the way to 6 o'clock in the morning for the farm worker community. And in addition to what I was explained before, we recognize that some of those members, they go from buses to secure a job for the day. And with that in mind, we realized that some of those farm workers were not wearing masks. And there was an interchange of population on a daily basis. And so what we did, our first step was to create a connection to the city of Mexicali. And for that matter, you see it on the picture, in the first picture over here, you'll see that there was a private meeting with the city officials in Mexicali and the County of Imperial to discuss about the challenges, the data that we have related to COVID-19, and to share our concerns, and at the same time to find potential solutions to reduce the spread of COVID. So with that in mind, the city of Mexicali mayor and our board of supervisors, chairman of the board at that time, Mr. Luis Plancarte, signed a document among the two jurisdictions to, it's called the letter of intention, in which both entities decided to promote the strategies that alleviates the spread of COVID-19. And so, as you can see in the picture on the right side, you see them both signing this document. And the mayor of Mexicali was in our county's building along with her staff, which involves the police department, the fire department, and the executive office of that Mexicali, as well as our side. We have the same officials on our side. The second approach that we took in general was to visit to the hospital in Mexicali. As you may or may not know, the city of Mexicali identified one of the hospitals, the general hospitals, as a COVID-19 hospital. Only patients with that were found to be positive were sent to this hospital. And so Dr. David Duncan, the director of the California Emergency Medical Services Authority, came to visit us, because if you remember, or you may not remember, the County of Imperial was in a purple tier. And so the state has a large concern, a big concern about our numbers. And so they wanted to have a better understanding. Through the health department, we made this connection, and I want to acknowledge the health department, because they really work every day trying to make it work for the community, putting themselves with the numbers and the information and preventive methods to slow the spread of COVID. And so they invited Dr. David Duncan to come to Imperial Valley, and he visited the facilities over here, and then we took him across the border to the hospital. He met with the hospital's officials and understood the situation very close. And in addition to that, he was able to have a meeting with the city mayor in Mexicali to also understand other areas of concern. And the results of that meeting was the following. They identified the 4 different situations. The border crossing was the number 1, in which farm workers were crossing the border with no mask or PPE, like face shields or hand sanitizers. We also identified public transportation was a large issue in Mexicali, because as many of you know, Mexicali is, along with the metropolitan area, is around 1.5 million in population. And so everybody can use public transportation and commute to different places in Mexicali. Also, there were areas that were identified with high numbers of COVID cases, and Mexicali was performing what is known as Mexicali sanitary filters, which basically was an inspection after the crossing of the border. And so they were promoting the residents to wear the mask. But Mexicali has its challenges in regards to masks. As you may remember, masks were not available as easy. So Dr. Duncan advocated with nonprofit organizations on this side of the border to find a way for us to donate 1 million face masks to the city of Mexicali, among face shields and hand sanitizers and gloves. All the donations were made by anonymous private donors, and both entities were asked to develop what is known as the binational mask campaign. And you can see on the bottom, there's a photo with the Yo Uso Cubrebocas, which is the campaign. It was done in English and Spanish. And you can see also on the pictures, people putting together in the port of entry. We work with the both sides of the border, with the customs agencies to be able to transport those face masks and an additional PPE. The third approach was also to create a campaign, a binational communication campaign. And as you can see on the first picture on the top left, our supervisor and the mayor of Mexicali wearing the shirts promoting the face mask. And there were some series of videos that were promoted on both sides of the border, in our social media, and in every place that we can find the TV, so that we can slow the spread of COVID-19. So those are just some of the strategies that we used during the COVID-19 to slow the spread. Again, this is work done by both municipalities with the assistance of several departments, from the health department, number one, the fire department, the police department, the sheriff department, all of us included, and the administration offices on both sides of the border. So with that, I will pass the presentation to Gil, because he has additional important information. Thank you.
Thank you. I'd like to add that in addition to our public health department, our agriculture commissioner's office also distributed over 1.5 million masks and hundreds of thousands of PPE to the local agricultural workforce as well. So it was from not just only our health department, but also our agricultural commissioner's office. But what I do want to talk about is also changing perception. I mean, even hearing some of the things in the past 10 minutes, it kind of may give a negative perception of our region. And we're not trying to overlook some of the things, but when you look at even in our local news, it's common to see the briefs and with all just negative headlines, which I think is unfair, considering you can find similar incidences here in our valley. I know Daniela mentioned substance abuse over the past year. Substance overdose deaths have tripled in our county, and so that is a need. But it's also changed the perception of sometimes simply the negative. I waited on tables for a long time, and always the negative overshadowed all the positives. But beyond even local headlines and whatnot, even in regards to media, and I know might be unpopular, it's a great show I watch, but Narcos, even though it does some really great things, even some of the characters and the environments and the shows and even the dialects are true to the regions that they are in. It is centered on a US DEA perspective, narrated by Texas tinged male voiceover, and it centers on this perspective and implicitly blames drug trafficking on a corrupt, violent, and ultimately unreformable Mexico. And that's from Vanessa Frigi, author, historian, and assistant professor of international studies at Washington University. So some of these things may just put a negative perception into the minds of people who don't understand our region. We understand it, and we're here, we live it, and we see the beauty and some of the flaws and inequities and injustices, but our region isn't just foreign and also to those across the state, across the country, but also locally as well. It's Dan Werb, epidemiologist who wrote a book on the Tijuana area, kind of showed an aerial view and how on the south portion of the border, it kind of pushes up against the border, and then as you get into the America, it kind of spreads out. And I think as you get north, even in the county, the border region and Mexicali and the southern does seem a little foreign. And these kind of headlines can kind of put into their mind negative perceptions of really, there are some really great things. There are great things in the city of Mexicali. You have not just from the community standpoint, but you have community organizations such as Verde Mexicali Verde, which is set to plant 60,000 trees. You have a baseball team. You have revitalization put forth by now the first Latina governor of Baja California, Marina, who I met at our meeting, and also a really big art movement, which harkens back to which also has some history in the Mexicali muralism, a Mexican muralism that dates back to the 1920s. Of Diego Rivera, Jose Orozco, and David Siqueiros, which even ties into some of the American Chicano muralism of the 70s. So it all kind of ties in together, but I wanted to point out the muralism and like I said, the art and how it can bridge, because it does tell a story, right? There is history on how these murals told stories of those who may not have access to books, may not have been literate, and it tells a story. And I think as we move forward through COVID, we'll see these murals pop up and telling the story from a more local level of those communities and how COVID impacted them, and told through artwork and told through a language that all can understand. So I just recently just went down there on Friday for Dia del China, and walked around and noticed all the murals once again. And so, as Brenda said, I think what COVID did was obviously it highlighted and magnified some of the inequities, but also really drilled home, I think, for many, the need for collaboration, how we're reliant on one another, not just Imperial Valley, Imperial County, and Mexicali, and not just simply for workforce, but for local economy, small business, education, healthcare. I really think drilled in that we're reliant and we need each other, and we need to build each other up, and that we can learn from one another, not simply a one way, but learning what they're doing well and what we're doing and how we can collaborate to help all, not just individual residents on this side or that side, but all. We are one region. So a photo on the left, you see Esperanza at the inauguration of the governor. She got one of the invites. Unfortunately, I didn't. And then you have our county supervisor with the new mayor, Norma Bustamante. And then on the right, you have me with, so we're trying to take an approach at all levels, not just from governmental and local organizations, but also with the media, and with the studios of Canal 66 on how we can collaborate. And like I said, combat some of those perhaps negative headlines that we're seeing. Below is Marco Peroni from the Imperial County Air Pollution Control District, sharing on the overview and successes of AB 617, which is addressing air quality in the southern region of the Imperial County. And he's presenting at an Imperial Mexicali Binational Alliance meeting. In the middle right there below is CARB and Mexican officials on the air monitoring. And then as well as Respira Loteria from the ICA PCD, that I think we can help going back to the education and targeting students and building a future that they're aware of, including binational elements and bilingual elements that can help the children understand some of the issues, that they can build upon that. Just in Burrell Elementary School District, where I sit on the board, we just started a dual language immersion, and we're trying to collaborate with Mexicali officials utilizing virtual technology to really build a bicultural, bilingual children who can really appreciate our region and the two cultures that come together to create what is La Frontera, the borderlands. And then below there is a picture of Dia del China. So not many people aware, especially I wasn't, the history of the Chinese population in Mexicali. At one point, I think it was 10,000 Chinese individuals and only 700 Mexican residents in the city of Mexicali. So there's a rich Chinese history that I was fortunate to attend, and that they celebrate in their downtown revitalization of their downtown area. So, there's potential. Like I said, I think COVID showed us from a governmental perspective as well as from a community of the importance of working with our neighboring city. And like I said, from the mayor coming down to introducing herself, I think many people weren't aware of the mayor of Mexicali prior to this, but this really showed that there's a need to understand all from our sister city to the south. So that being said, that concludes my presentation. There's a lot more I'd like to share, but I'm sure we'll talk about that in the Q&A. Thank you. I appreciate the time. It was an honor to be here.
Thank you, Gil and Esperanza. The point you make about perception is critical for the border. And incidentally, the same conversation goes on among San Diego and Tijuana leaders, talking about the negative perception in Washington and Mexico that produce negative policy impacts in the entire border region. So it's a common issue we all share along the border, and I'm not sure there's a good solution to it, particularly when we have it adopted in political discourse nationally, and it's difficult to overcome that. But thank you for your observations, and very nice to hear about the tremendous local effort in response to COVID. So I think now we'll move on to our third presentation, which will look mainly at the other side of the border, the Mexican side in the municipality of Altar. Our presenter is Samuel Loroña, who is the Director of Archives for two small municipalities in northern Sonora, Tubutama and Atil, that are adjacent to Altar. And he's going to talk about movilidades pandémicas, migrantes y mafias locales en Altar, Sonora, en tiempos de COVID-19. So, Samuel, please take it away.
Muchas gracias por la presentación y buenos días a todos. Un momento. Perfecto. Bueno, muchísimas gracias por permitirme hacer esta presentación en esta plataforma. El tema que voy a presentar trata sobre migrantes y, bueno, dentro del contexto de la pandemia de COVID-19 en una región, en un municipio muy particular de México. En este caso estamos hablando de la región de Sonora y Arizona, que serían los estados vecinos de Baja California en México y de California en Estados Unidos. Este trabajo fue hecho en el verano de este año a través de entrevistas a profundidad a migrantes centroamericanos en el municipio de Altar, Sonora. Tenemos dos protagonistas muy importantes en este trabajo. Primero están los migrantes centroamericanos y segundo, el control de las mafias locales en un municipio fronterizo como lo es Altar, Sonora. Altar, Sonora es un municipio de lo que muchos académicos denominan la franja fronteriza. La franja fronteriza que se extiende 100 kilómetros al norte de la frontera en Estados Unidos y 100 kilómetros al sur en México. En este caso, vemos en el mapa que Altar, Sonora tiene frontera con Estados Unidos. Y yo lo enmarcaría dentro de lo que otros académicos han denominado la frontera porosa con Estados Unidos. ¿De qué se trata la frontera porosa? Que hay lugares dentro de la larga frontera mexicano-estadounidense que no han sido cubiertas por el muro, que se puede ver en lugares como Tijuana, como Ciudad Juárez o algunas otras ciudades de Tamaulipas. En este caso, solo hay un fragmento de muro en lo que sería la garita de Sasa de Sonora, que es uno de los puertos de entrada del estado de Sonora hacia Estados Unidos. Y segundo, que contamos con poca revisión o poco patrullaje de la patrulla fronteriza debido a que se trata de un lugar donde se encuentra el desierto. En este caso, ya podemos hablar de cambios y permanencias dentro de las actividades ilícitas en Altar, Sonora. Estamos hablando de un municipio que tiene una historia muy marcada con el tráfico de drogas a inicios del siglo XXI y que continuó hacia principios de nuestra década, 2015-2016, cuando es entonces que se produce un cambio debido a la baja demanda de drogas. En este caso, los cárteles locales, los grupos delictivos locales hacen el cambio en lugar de traficar drogas, en este caso marihuana, estamos hablando del tráfico de personas. Lo que se define como que los cárteles locales se hacen del control de la frontera por el lado mexicano, entonces son ellos los que permiten la entrada de migrantes a que intenten cruzar a Estados Unidos. Entonces, estamos hablando de un control fronterizo antes del control fronterizo ejercido por Estados Unidos del lado estadounidense. Entonces, este trabajo está enmarcado dentro de la pandemia de COVID-19. Por lo tanto, estamos hablando de movimientos migratorios de personas centroamericanas y del sur de México hacia, hacia Estados Unidos. Todos ya sabemos por múltiples estudios que las desigualdades se remarcaron, bueno, se acentuaron entonces, estamos hablando de movimientos por parte de personas hacia Estados Unidos por medio de lo que es el tráfico de personas. ¿Cómo se ha dado este movimiento dentro de la pandemia de COVID-19? Estamos hablando de personas que intentan ir a Estados Unidos por medio del tráfico de personas. Entonces, tenemos experiencias de vida muy duras en las que las personas no saben dónde están o dónde se encuentran por 5 o 6 días desde que salen de su país de origen en Centroamérica, ya sea Nicaragua, El Salvador, Guatemala, hasta llegar a Altar Sonora, que es el punto de cruce hacia Estados Unidos. Entonces, veamos qué son estas nuevas realidades del tráfico de personas en Altar Sonora. Altar Sonora tiene una historia de población flotante de estas personas que llegan al punto fronterizo y que quieren cruzar a Estados Unidos. Entonces, esta población flotante siempre ha estado muy presente en la dinámica del municipio. Es entonces que llega el periodo presidencial de Donald Trump en Estados Unidos y sus políticas antimigratorias. Entonces, ¿qué es lo que ocasiona? Lo que ocasiona, en este caso, un endurecimiento de la política migratoria mexicana que hasta antes de Donald Trump permitía el libre paso de personas por todo el país, a estas revisiones en puntos específicos antes de llegar a la frontera. Los cárteles locales, estos grupos delictivos locales, entonces crean un nuevo sistema de tráfico de personas internacional que tiene mucho que ver con la conexión del tráfico de personas en Centroamérica y la conexión de los traficantes de personas en México. El tráfico de personas no se puede llevar a cabo sin esta conexión. Es entonces que se desarrolla un nuevo sistema. ¿Cómo supimos de este sistema? Por las personas del municipio de Altar que dieron información sobre la situación que se está llevando a cabo. Entonces, desde el endurecimiento de las políticas migratorias estadounidenses, mucho más, y de las políticas migratorias mexicanas, es entonces que los grupos delictivos tienen que buscar la forma de transportar personas desde Centroamérica hasta la frontera con Estados Unidos. Entonces elaboraron un sistema de movilidades, de traslados alternativos, de traslados por rutas alternativas diferentes a las rutas que normalmente una persona que quiere llegar hasta el norte de México utilizaría. En este caso estamos hablando de puntos ciegos de estas caminos rurales o caminos peligrosos que usan los grupos delictivos para transportarlas y que se llegue hasta Altar de forma segura sin que el ejército o la Guardia Nacional en México los detengan antes de llegar a la frontera. Es por tanto que durante ese transporte, durante ese movimiento de personas, los cárteles locales mantienen a los migrantes en situaciones, podríamos llamarlas inhumanas, e incluso han desarrollado este sistema de bodegas en los que se resguardan a las personas del lugar de transporte en transporte. Si llegan a un lugar, son resguardados en una bodega, se mueven a otro lugar, son resguardados en otra bodega, así hasta llegar al Altar, Sonora, donde están resguardados en bodegas y se les prohíbe su salida para que agentes del ejército o de la Guardia Nacional no los arresten o no los regresen o no los deporten a sus países de origen. Aunado a esta política, bueno, a esta estrategia de resguardo en bodegas, estamos hablando de que los cárteles locales controlan la frontera mexicana. Entonces, si un migrante decide o desea cruzar hacia Estados Unidos, además de pagarle a un traficante de personas antes de su traslado hacia Altar, Sonora, tiene que pagar a los cárteles locales para intentar cruzar a la frontera. En la siguiente imagen estamos viendo lo que sería un traslado normal de 48 horas, 2 días, desde una ciudad, un lugar que se llama Comayagua, Honduras, hasta Altar, Sonora. 48 horas en carro por la vía más rápida, 52 horas, lo más extenso que podría alargarse el viaje. En este caso, como ya lo mencioné anteriormente, estamos hablando de traslados de hasta 2 semanas en los que los migrantes son transportados por todo México para poder llegar hasta Altar, Sonora, y no utilizando estas vías que estamos viendo, que podemos observar en la imagen. Entonces, ya para finalizar, a propuesta de una migración libre y segura en el territorio mexicano, el Estado mexicano debe garantizar que los movimientos de cualquier persona, independientemente de su nacionalidad, sean libres y sean seguros en el territorio mexicano. ¿Para qué? Para que estos migrantes no sean cooptados por los cárteles locales y no estén dentro de una situación insegura en el momento en el que ellos deciden inmigrar. Entonces, lo que tenemos aquí es una visión punitiva de ambos gobiernos, ya sea de Estados Unidos y de México. En este caso, México ha adoptado medidas mucho más rígidas en cuanto a los movimientos migratorios para detener a estos migrantes en su intento por cruzar a Estados Unidos. Entonces, se deben de elaborar estrategias para proteger a los migrantes que deciden migrar de forma internacional. Y obviamente desarticular las redes de grupos delictivos locales, ya sea en el ámbito financiero, porque la afluencia de dinero por parte de migrantes hacia los cárteles locales o hacia los grupos delictivos es mucha. Entonces, se tiene que desarticular los grupos delictivos locales, atacar sus finanzas, obviamente, y poder garantizar una migración libre y segura dentro del territorio mexicano. Y con esto concluyo la presentación y esperando tengan preguntas. Muchas gracias.
Bueno, mil gracias. Muy buena ponencia. Thank you very much for the presentation. Very helpful and very useful to help understand a very important component of what we see in all of our border regions, really everywhere along the border, but as you point out, particularly in the Arizona-Sonora area, which has less infrastructure and patrol by U.S. Border Patrol, so it tends to have greater migration from Central America. Okay, what I'd like to do now is turn to a question and answer period. We have about let's see, 25 minutes or so. So we should have a good discussion. What I'd like to do first is ask any of the presenters or co-authors of the papers if they have any questions or comments to lead off the discussion. Alexandra, I guess not. So
actually, I think Daniela Flores has a comment.
Hi, thank you
Okay,
so much.
thanks.
I can just, just share one quick comment that I'm not sure it launches into the full discussion, but, during the presentation, part of our call to action is really to use these numbers from our farm workers study for advocacy. And so we welcome you all to cite this study, and, we encourage folks to look out for publications that will come out of San Diego State in the future, hopefully, with this paper in particular. And then we also conducted qualitative interviews with farm workers. So that's another, work that will come out in the future as well, that you can also look for additional context on what we presented today.
Good, thank you.
Luis, I don't know if there's anything else you wanted to add. Okay, we're good, thank you.
Well, let me just make a couple of comments before we open it up to everyone. First of all, the presentations, I think, fit very well together, and it really helps us better understand the realities of a significant part of our border region. One that does not include major U.S. urban areas, but large Mexican cities, as well as rural areas on both sides of the border. All of the presentations today raised some really serious problems in how the border functions and how the U.S. and Mexican governments manage the border, or in some cases don't manage it, as we've seen. And so really that raises the issue of what kinds of solutions do we have for these problems? And I think some of the presentations have clearly identified the problems, suggested some general solutions. But when we drill down to the local level, for example, how do we get the city of Calexico or the county of Imperial to take policy actions to correct some of the problems that we've seen during the pandemic or during the regular situation of farm workers in the Valley? And I think this is a critical thing to think about, because the current pandemic is, I'm convinced, the first of a long series of major crises we're going to see on the border, whether brought by climate change, natural disaster, or other pandemics. And I think we need to figure out how to deal with issues quickly and get local authorities fully involved so that we can deal with the next crisis. But perhaps if any of the presenters have suggestions on how we turn your research findings and advocacy recommendations into actual policies, that would be very helpful, I think. So Danielle, I think you might have a comment.
I'm also happy to speak to that.
Good.
So I think we identified, I think resources is always the first kind of question that emerges in these kinds of advocacy efforts, and this is why I think ARPA is this kind of great moment where there are resources there and priorities sort of, still need to be taken up. But I think we do advocacy, and part of what we're doing is research and sort of trying to sort of put numbers behind realities that most folks kind of have a sense that are for. But I think part of what we also recognize is that the barriers are often political, in the sense that there's no like natural constituency for like advocating for farm workers often, right? So we know citizenship and voting isn't always sort of reliable among farm workers as an avenue for political engagement. So there aren't necessarily the incentives for elected officials to sort of foreground the material interests of this population, right? So we know in Calexico, the ARPA spending priorities are starting to be put forward. So far, it's been sort of bonus payments for city employees, new fire patrol and law enforcement vehicles, but there's still $5 million left unaccounted for, right? So I think this is the political question of does community engagement show elected officials that there are political consequences for not sort of addressing these issues, right? And if farm workers themselves aren't able to vote, in part because of this daily migration status, then sort of it's on local residents to sort of vocalize this as constituents, as desires, right, for local officials to address.
But more broadly, for the Imperial County, the companies and individuals that utilize the farm workers are absolutely dependent upon those workers for agricultural production and their own prosperity. And are they not able to translate that need of those essential workers to local politicians who control spending in either Imperial County or in the city of Calexico?
Yeah, if you may allow me, we, the County of Imperial, from the Board of Supervisors as well as the cities, they do recognize the need of the farm workers. As I mentioned during my presentation, we had $2.9 billion in economic impact in our community. And for that reason, Agricultural Commissioner was working directly with the companies, the farming companies, to provide PPE to the farm workers to potentially assist in other ways to this community. And I don't know if you may recall, part of the program, the Agricultural Commissioner included a program that it was placed by the governor to temporarily relocate farm workers in the community. And this is one of the programs that I can't recall exactly the name of the program, but it's a program that assisted those farm workers to stay safe in an isolated area, like a special locations for them to remain during the COVID-19. One of the challenges that we have at the border as well, which I failed to mention, is that due to the lines in crossing the border, some of the farm workers decided to stay wandering in the city, not because they don't have, they didn't want to go back to their homes, but because of the length of the lines to cross the border. And so that makes them to become homeless, a type of homeless population. And so the County of Imperial, as a proactive measure, knowing that they're on the streets, they created like what is called hand washing stations. And so they were spread out throughout the city of Mexicali, the city of Calexico, because that's the place where they're usually stayed after they coming back from work, or where they stay and before they pick up a bus and go to work. So yes, it's a unique community, but all of our officials are very conscious about it, from the governor all the way to Imperial County officials.
Yeah, Luis or Daniela, do you have a response to that?
I'll just briefly just respond to one point. You know, we have seen models in other parts, agricultural communities that also are able to bridge partnership with diverse stakeholders, including the companies that hire these farm workers, right? I think in Imperial, perhaps this was an exercise that, you know, through the PPE, we definitely saw. And, you know, there were some cases where we saw some of that support through at work vaccination clinics, which, you know, were so important. And, you know, I think bottom line is just not sufficient for what needs to come. And ideally those partnerships are, you know, we would love for those folks that hire farm workers to really commit to the bathroom condition that is the reality of what they live with. And, you know, for the PPE that was distributed, you know, it really was a massive effort from all sides, from all groups. So I think that, you know, the last thing I'll mention in response to that comment is regarding, you know, the programs that were supposed to protect farm workers, like the Housing for Harvest that you mentioned. Unfortunately, it did not get implemented in Imperial County. It wasn't taken up by farm workers because of different barriers. And so I just want to name that, you know, there are some strategies that really require, you know, grassroots engagement to ensure that they're able to be implemented and bring the appropriate groups to support with that, and, you know, really identify what the barriers have been for that program specifically. Those are my comments for now.
Thank you. Do we have, Alexandra, do we have other comments that people have sent in?
Yes,
Or
actually,
questions?
yeah, we have quite a few questions. We have one question for Daniela. Have farm workers been surveyed or data correlation between COVID and asthma or COPD rates?
That's a great question, Priscilla. So at this time, we ended up only asking health-related questions around heart disease, high blood pressure, and just COVID-19 infection. So we didn't actually collect information around asthma. So that is a really good point. And I think, you know, we recognize that we have some of the most alarming outcomes in asthma, hospitalizations and whatnot. And as our group moves forward with some of this community research, we certainly look forward to bringing that into future work. And Luis, I see you unmuted if you want to add.
Yeah, so and the question on chronic conditions, I think asthma may have been one of them, but the reason we chose not to include them is an interesting finding was that we had very low reporting of chronic conditions, like below the population data that we would expect among Mexicali residents, and we had something approximating kind of like what we know are the county levels from Valley residents. So we didn't want to sort of we didn't want to create the impression that there's low chronic disease among Mexicali-based ag workers, but so we think that question was capturing something else, right? Which is like, are you aware of having chronic health conditions? So there was very low reporting of people that self-reported being aware of having chronic health conditions among Mexicali-based ag workers. But so there was one question around that. We're still kind of like not sure how to talk about the findings.
Thank you. We have another question. Do any of you get the sense that progress has been made towards these issues since the termination of the Trump administration? Or have public health and economic conditions continued to stagnate on the United States side?
So I will, could you please repeat the question? I'm trying to see if I can answer your question.
Of course. Do any of you get the sense that progress has been made towards these issues since the termination of the Trump administration? Or have public health and economic conditions continued to stagnate on the United States side?
You mean at the local level? I think at the local level, our agencies have followed the protocols implemented by the state of California as much as they can. We actually receive direct assistance, technical assistance from the state of California. A whole team came to Imperial Valley to address the needs of the most needed individuals in the region, not just in Imperial County, but the region. And so I think that really will not apply in this situation during COVID-19. I'm not talking about the overall other overall situations, but I'm talking about more so during the COVID-19, especially on the high rates of contamination. Our public health department and all other agencies, as well as the county of Imperial, they were working very close with the state of California, following the protocols and the assistance and the technical assistance. And so that's one of the reasons why we have this. Maybe Gail can correct me, but I believe we had the highest number of vaccinations in Imperial County than in the rest of California. So that just gives you an idea of how close we work together with the state. And Gil, I don't know if you want to elaborate.
Yeah, I think also, like, regardless of the administration, like I said, I know the politicals kind of get sometimes the attention and whatnot, but when it comes to like local government, it's thousands of employees, residents working regardless of an administration at federal level or even state level to serve the community. So, do we see any changes? I mean, we've been working nonstop for this entirety of this pandemic, and even moving forward as we enter into this winter. So. I guess that's what I'll share on that.
Do any of the other panelists want to comment on that question? Okay, if not, we can go on to the next question. This is for Gil and Esperanza. What efforts are underway to increase vaccine rates in children? Any information on opening another hospital and or securing funding for increased primary preventative care?
So I guess I'll start on that. So I know with children, I know the health department is setting up clinics in regards to schools. That is, well, it's a state mandate for the schools districts. So school districts will abide by the state, and you see some pushback locally. You see them saw it here at our county board of supervisors meetings in the past few weeks regarding some of the masking guidance put forth by our local health department and the pushback that got. And you're seeing school districts getting some pushback. But for the most part, from my understanding, school districts are expected to abide by the vaccine requirements for children to be in the public schools. So the health department will assist and promote vaccines for children. I know there'll be an elementary school, a public school in Brawley on Friday. And like I said, there's pushback on that as well from some in the community. So, but it's available for children, and we encourage it from a county level. And as far as opening of the hospital, like I said, the need for more healthcare resources have been there prior to COVID, from our physician shortage to even some of our ER visit rates are triple or quadruple even before the pandemic to hospitals in San Diego or in other counties as well. So that need continues to be there. It was there prior. It got exacerbated, magnified during the pandemic, and continues to be. So I guess goes into the need for more access and resources to healthcare for our residents and those in the Imperial County. We serve, like, also take into account, we don't just residents and those who come in to and from the Imperial County, but like our off-road season gets what, thousands, 20, 30,000 people, the prisons, another 1,000, the snowbirds. I mean, so this is a region that, although our population might say 170 something thousand, it fluctuates heavily, daily, hourly, seasonally. And so, yeah, 2 hospitals are strained, and you could talk to any healthcare workers. So the need was there before and will continue to be there. And that's what advocacy and really bringing attention to our region and the needs. It's important, not just from government, but like nonprofits and community organizations like that are here today.
There are other efforts you mentioned in terms of grants. And so I'm just going to elaborate a little bit on grants. The state of California made available $13 million for rent assistance to residents in Imperial County that were impacted by COVID-19 by losing their jobs, losing hours of work, or families that decided to stay to take care of the children because, as you may recall, the schools were closed. So we have a series of families that are on the verge of becoming homeless because they're being evicted from their homes or not paying the rent. But also the program allows for future rents and utilities assistance. And the county, while the county didn't receive the funding directly, we just did allocation. Our goal has been to promote the program as much as we can by utilizing nonprofit organizations that are known as the trusted messengers. And so it has been an effort, and I can tell you my numbers as of yesterday, more than 102% of those funds have been spent. And when I say more than 102%, it means that 30 million is gone, but also we're waiting for the second allocation for additional residents that are in need. In addition to that, the county put together different programs for businesses, grants for businesses, $10,000 for businesses that has to close their businesses. We also implemented a utilities program to assist the families from preventing them to get their electrical services, and work with the cities, the 7 cities in Imperial County, by providing them with financial assistance to assist families with their water services. And so we have made several efforts to assist all those who have somehow been impacted by COVID-19. You can go on our website, or you can send me a request, and I can kind of like put together all the programs that we have available. Our agencies like the Department of Social Services with the continuum of care, behavioral health, the public administrator, we have 26 departments, and all of those departments somehow, somewhere, they are promoting programs that are available for the residents in Imperial County to continue providing services for them. And specifically for funding for COVID-19, anyone who has been affected in one way or other, they can participate on our programs. And then we'll continue the effort. So today, we just about to start assisting other families. And so, but COVID is just one of the main issues that we have. There's so, as a county, we cover from Ocotillo, or a little bit high above Ocotillo, Winter Haven, Palo Verde, and the Salton Sea area. So we have a large area to work with. We have a small population, but like Gilbert mentioned before, we have an influx of many commuters coming to Imperial Valley, and we had to provide services to them as well. So I hope that I answered the question.
Thank you. I think we're nearing the end of our time now, so we'll need to wrap up. I want to again thank all of the panelists and the members of the audience who contributed excellent questions. And just reflect on what we've heard today. We've heard a lot about the intersection of research and policy. The research study that was presented to me in some ways was shocking, because I remember reading similar conclusions from things that Phil Martin wrote 20 years ago about the conditions for agricultural workers in California. So it looks like we haven't really made much progress. And COVID-19, I think, has highlighted those failures. And clearly we need to figure out how to move forward. It was heartening, however, to hear about the close cooperation between the County of Imperial and the municipality of Mexicali. And I think Esperanza is ideally suited, of course, as a cimarron and somebody with experience in local government. Very difficult to coordinate local governments across the border because they're so different. The rules of the game and structures are so different. And, hopefully something that can come out of COVID-19 is that at a local level, we can figure out how to permanently work together across the border. not just respond to a crisis or take advantage of one elected official or another, but permanently. And finally, Samuel's presentation about the intersection of COVID and the drug mafias in Sonora was really quite revealing, and it shows almost intractable problem that the U.S. is clearly linked in. I mean, the growth of Mexican cartels is very much related to demand for illicit drugs in the United States, the flow of arms from the U.S. south into Mexico, and now as the cartels have shifted their business operations to take advantage of migration, it's really added additional levels of burdens on people attempting to migrate. And that's just a huge problem for both Mexico and the United States. So I think today we've learned a lot about problems. We learned a little bit about solutions, and hopefully we can do a lot better the next time we have a crisis that affects the border. So thank you all for participating, and please enjoy the rest of the day and the other presentations.